Delving into those. My name is Serfine Ouma, and our sign language interpreter this morning is Susan Thuku, and I'm having that very important conversation together with my guest for this first hour. His name is Peterson Wachira. He's not a new face to us. Peterson is the national chairman of the Kenya Union Clinical Officers. Thank you so much, Peterson.
And thank you so much, Serfine, for having me.
All right. Yes. So it must be a very tiring season for you. I was sharing with you this earlier before we began the program. Yeah. Just battling the COVID-19 pandemic. You are the frontline soldiers, and we depend on you a lot in this particular war. Let me just paint a picture of how the situation is as at last, night. In the last 24 hours, I believe we'll be receiving, new figures today. But as at yesterday, the positivity rate in the country stood at 12.5%. Yesterday, the Ministry of Health recorded 591 new cases from a sample size of 4,737. So far, 3,970 people have died. And if you look at the vaccination, exercise that is currently ongoing, 1,726,937 people have been vaccinated so far. We will be looking at, whether this is good enough for us or what is happening in just a bit. But Peterson, just as an opening question into this conversation, a positivity rate of 12.5%. Last week it went as high as 18%, and we have been recording this double-digit positivity rate for quite some time. What are you reading from this? Are we winning or are we playing catch-up?
I think what we can say is that it's definitely true that we are in the fourth wave. And a wave is defined by what we are seeing currently, that we are having a positivity rate that is going higher. We must also note that what we are seeing is just but a sample of the population. And sometimes all we would be able to tell is that we have a surging rate of infection, and that is the positivity rate. Forget the numbers, because 12, 18 depends on so many factors. One factor being, we are not testing everyone. If we were to test everyone, if the tests were available to any person who needs them or who wants it, then we would say that that's a true positivity rate. But currently what is happening, the people who are being tested are people who have to be tested. Either you are going back to work, you are traveling out of the country, or you are sick. So sometimes it's quite difficult to tell. But one thing that we can definitely tell is that the positivity rate is going up. And I think by now, every Kenyan knows somebody who has actually been hit by this virus. And I think we are past that question of whether actually COVID is real or not.
But you'd be surprised. There are people who still feel like this is a game being played. There are people who still don't believe that there is COVID, even as we are speaking this morning. Yeah,
actually I've seen even on social media, some people saying that once we are heading to the end of the curfew period, the positivity rate will rise and then we'll go back. But I don't think that is the true picture. There may be a coincidence, but for real, and for us especially who have been interacting and treating and taking care of these patients, we know that COVID is real. And I need to warn Kenyans that especially this Delta that we are dealing with, that we don't even know if it's a variant of the Delta from India. Number one, is very contagious. Number two, it progresses very fast. So we are seeing so many people who are actually requiring that hospitalization. And what we have been trying to do all this long is to ensure that we have very few numbers coming to hospital who have oxygen demand, so that we actually do not lose people because we don't have resources. Because I think we have come to that acceptance that we do not have enough resources to be able to take care of our people. So people must know that COVID is real. I think most of us have now interacted. I know relatives. My own dad was in HDU for like 2 weeks. And I think Kenyans, we have this, we want to see it for ourselves so that you can believe.
That's the worst mistake anyone can make, to learn from something when it is happening to you. We don't have this culture of learning from other people's mistake. That's the worst, I would say. I would term it as an injustice that we can do ourselves as a country. Let's wait and see.
Actually, the wise people will say that you are foolish if you can be able to see it, but you cannot believe it until it happens. You suffer yourself. That is defined as foolishness.
Let me take you back a little bit before we talk about this Delta variant. You say that this could not be the true representation of the situation as it is. Are you basing this on our testing capacity? If so, how many people are we supposed to be probably testing per day to say that we have met that threshold that can give us that true picture of how many people are positive and, you know, what's our positivity rate as a country? Where should we be at to say that we are safe at this point?
What I'm trying to say is, in an ideal situation, the test should be available to anybody who wants to be tested.
Whether you're sick or not?
Of course, when you're going to be tested, you are going to have your own suspicion.
Okay.
But currently, the tests that we are conducting, because of limitation of resources, we are only testing to those who really need them. And some of them are actually paying for them. And you know, if you actually have to pay for that test, it means that we are excluding a certain percentage of the population. So the only people we are testing, it's either you have gone to a hospital, you are sick, or your work requires that you be tested, or you are traveling out of the country. These are the only 3 categories that we are testing. But we know that with COVID-19, a majority of the people will actually be asymptomatic to mild symptomatic, having a few symptoms that cannot actually even take you to a hospital. So the whole of this category, we're actually missing them. And so the positivity rate we are seeing is only from these 3 categories of people who are being tested, who are a minority. And that is why I'm saying, forget the numbers in the positivity rate. The only thing that we need, that is definitely true, is that the positivity rate is rising. And that means that that surge means that we are actually in the 4th wave.
All right. Yes. So the situation could be different from what we really are getting. We will be engaging more on that, but of course we're also following up quite a number of activities for you, including the fact that this particular morning there is the flagging off ceremony of Green Zones Development Support Project Phase 2 project vehicles currently happening at the Kenya Forestry Services Headquarters, Karura Sports Ground, right here in Nairobi. I just want us to quickly cross over to that particular function, and then we will I'm guided that we will be heading there any minute from now. We have our reporter there, Ben Troy Njue, following up that for us. As soon as he's ready for us, we'll be crossing over live to him. And then we come back to this particular conversation in a studio. Right now, we are talking about the COVID-19 situation in the country. And I'm hosting this morning Peterson Wachira, the chair of the Kenya Union of Clinical Officers in the country. So, Peterson, there's been a concern about how fast this virus is spreading in the country, especially now that you're dealing with the Delta variant. I don't know whether it's the virus itself that is spreading faster than the other variants, or it's just our way of life and how we have sort of put our guard down in this, in this battle against the pandemic. What could be the issue here?
I think the issue is that it's a multifactorial issue. Yeah. Number one is that, as I said, the Delta virus is has been seen to be more contagious. Means it's highly infectious, even more than the variants that we have had prior. The second thing is that we are not disciplined, both us as the public and even our leadership. And I say our leadership in quotes, because sometimes what defines leadership does not fit. And I'm saying this because, number one, for so many months, we have known that there is a variant that is more infectious, more contagious, progresses faster as a disease. We also knew that it came to Kenya, and we started reporting from Kisumu. But even from when it was in Kisumu, you have seen our behavior as a nation. Both we as the people and our political leadership, we have been bringing people together, sometimes without even observing the protocols that we have put in place for ourselves. Because we must understand that whatever protocols that we put in place for containment they are not for the government, they are for us all.
Yeah.
So when you see crowds being pulled together in Kisumu without even masks, when you see in by-elections people being brought together, and somehow it's like we have accepted that during political moments we can be able to suspend these containment measures, and we just let it loose for some time.
So it works for some people sometimes, but it doesn't.
It works for some people. You even saw during the safari rally in Naivasha.
All right. We are coming back to pick up from there. We also want to understand the situation in Mombasa County. Remember, we are talking about COVID-19. We have Ann Buru on standby for us in Mombasa County just to tell us what is happening in terms of the spread of this virus and the containment measures the county has put in place to control the spread of the COVID-19 pandemic, the COVID-19 virus in Mombasa County. It's over to you. And what do you have for us from the coastal region?
It is indeed a good morning from Mombasa County, Serfine Achieng at Broadcasting House, and we're coming live to you from the Kenya Medical Training Mombasa campus. And today we'll be discussing about the Delta variant, the COVID-19 Delta variant, how hard it has hit. This being the fourth wave. We've seen that the Coast Provincial Teaching and Referral Hospital is full to capacity. The COVID-19 wards are full to capacity. The isolation wards are full to capacity, and the county has taken initiative and even had extra beds, and we have extra beds at the Chuda Healthcare Center. And right now I'll be joined by the Kenya Medical Practitioners Dental Union National Chairman Dr. Abidan Mwachi, who's going to just paint a picture of this variant in Mombasa County and how it is here in Mombasa County. Karibu sana on set, Bwana Daktari. Please just paint a picture of the variant here in Mombasa County.
It's true that the numbers are rising, have kept on rising. Clear indicators were showing quite early on that we are deep into the fourth wave. Of course, the testing is not up to par for one reason or the other. We can only speculate, but that the numbers are rising, that's true, and that this particular variant is also more dangerous, more lethal, and also more unpredictable is also true. The absolute numbers, of course, given from the Ministry of Health cannot be ascertained because there are patients out there who have not tested yet, but who exhibit those symptoms. So those are not numbers to go by, they're just statistics to shed light on what the bigger picture could be.
Maybe what advice would you give to the residents of Mombasa, keeping in mind that they need to follow the protocols, the health protocols that have been aligned for them?
I know it's tiring, it's serious, it's going to 2 years. We are not out of the woods yet, and all indications are that the only thing that will be required for us to get out of the woods will be aggressive, massive vaccination. Are we there yet? Absolutely not. But for now, nobody should let down their guards. Continue with the protocols as indicated. Don't mind who is not breaking. I mean, it's your sole responsibility to keep your part of the bargain moving forward. Yes.
We have also information that the reagents are not enough to test the COVID-19. You can also tell us about it.
Yeah, as would be expected, testing has been an issue. Just like as we started, the PPEs, provision of PPEs and lack of personnel was an issue. So this far also testing has been an issue, and beyond testing also the availability of the drugs that are needed to manage COVID has also been an issue. So in the public domain, of course, the numbers of people who are being tested voluntarily will be affected, because if the reagents are few, then fewer and fewer numbers will get tested. In the private domain, of course, this is limited by the cost implications of it. I think one test goes for around 7,200, and not so many Kenyans can afford that. Yes.
Maybe you could also tell us the numbers that you have, those who have been vaccinated with the AstraZeneca vaccines. Maybe has the number increased, or are they coming for the vaccination?
The uptake now is slow, as you could imagine. The figures from the Ministry of Health tell us that about 1.6, 1.7 people have been vaccinated, with only about 600,000 getting the second dose. Those are the ones who are fully immunized. And for all intents and purposes, it's correct to say that now only 600,000 people have been vaccinated, because until you get the second dose, we can't count you as properly vaccinated. So only 600,000 people have been vaccinated across the country. And we are hoping that with the message being driven out there, the anti-vaxxers, the people who are against the vaccine, will now see clearly and let go of their fight so that Kenyans get the right information and access vaccination, because that's their only weapon in this war.
Maybe you could explain to Mombasa residents briefly to understand this Delta variant compared to the Alpha variant, how lethal it is.
Well, the reports coming in from the people managing the COVID patients are that the Delta variant, first of all, is more lethal, is more unpredictable, more lethal in the sense that we are experiencing a higher mortality rate, if I may use that terminology. And also that its unpredictability comes in the way that you might get a patient who is almost on the verge of getting discharged home. Then they die of other complications, and most of them are cardiac complications, because the variant also affects the heart. So it's a very unpredictable strain and very, very aggressive, more infectious than the other one that was there in the first, second and third waves.
We've seen that the community transmissions have been very high. Maybe what point would you drive to the residents of Mombasa? Because most of them would see them that they no longer put on masks. The social distancing is also an issue. Maybe what would you tell them?
I mean, it's now upon us, everyone, to still do their role, keep social distance, put on your mask, wash your hands. The virus is here, and it's here bigger and better. Not better in that terms, but better in terms of its own self, that it's more lethal and it's more aggressive. We are probably, if there was any one time that we needed the masks and keeping social distance, this is that time. Yes.
Okay, you've heard it from the doctor himself, and right now the residents of Mombasa and everyone in the country has been urged to put on their masks and put the social distance, ensure that you have the social distance. Back to you in studio, Serfine.
Thank you so much, Anne, for that update coming to us from Mombasa County. And they're engaging Dr. Abidin Moachi, the chairperson of the Kenya Medical Practitioners, Pharmacists and Dentists Union in Mombasa County, and of course raising quite a number of pertinent issues, Peterson, including the fact that we are not, our testing capacity as a country is really lacking and could not be representing the true picture of the situation, and also talking about the progress that we have made in terms of the vaccination, exercise. But we'll get to that later. I just want us to reiterate one thing about this virus and how fast it is spreading. Before we went to Mombasa County, you were talking about it is something that we need to look at in 360 degrees, looking at our way of life and also looking at how severe this virus is. And you were talking about certain containment measures that sort of apply sometimes, but at certain times we sort of like loosen things a little bit. We'll be picking up from there. I'm told let's cross over once again to the Kenya Forest Service headquarters in Nairobi. This is at the Karura Sports Ground. I was telling you earlier about a function that is currently underway, the flagging off of ceremony of Green Zones Development Support Project Phase 2 project vehicles currently happening. Let's listen into what is going on. The CFF is currently speaking.
Conserving about 2.959 million hectares of forest in the country. Beyond that, we also support the county government technically and also capacity build them to also be able to manage another 1.7 million hectares of forests. And beyond that, also provide advisory services to the private forest owners. That's a huge mandate. And therefore, it is not possible that Kenya Forest Service alone is able to implement the mandate totally, considering the circumstances around that. And therefore, that's why Kenya Forest Service has put in place a very strong partnership and linkage initiative to be able to rally partners who can come and join us and support us and complement our effort to be able to advance our mandate, serve and protect these public forest resources. It is on this premise that in 2018 and previously, there were discussions with the African Development Bank, and they did then agree in partnership with the Kenya Forest Service to be able now to partner in this project, the Green Zones Development Project Phase 2, and which was signed in December 2018, but the commencement of its implementation was in July 2019, and is a 6 years project funded by the AFD under the government of Kenya. The AFD, African Development Bank, injected about $50 million, while the Kenyan government injected $5 million. And it's for 6 years. And the main objective is to conserve our forest resources, but also support community livelihood for sustainable forest management. It did aspire that government alone, without working together with the communities and improving their livelihood, would be very difficult to sustainably conserve forest resources. And that is the basis of this project that we are here today. The project has done an amazing job, and it is going to tackle one of the issues that we have as a country, that is trying to restore our degraded natural forest areas. As we speak today, we have assessed that about 480,000 hectares of public forest are degraded. This project in these 6 years aspire to help Kenya Forest Service to restore about 337,500 hectares of that. And beyond that, it will support us in restocking our plantation areas, and it has continued to do so in this. And our commitment, it is to turn our forest stations to be the centers of excellence. We must ensure that we solidify and we have a very critical firm foundation. And the only thing we can do, it is to channel resources to the forest station manager. And I have a serious conversation with our senior managers, with the head of conservancies, with the ecosystem conservator, that the work do happen at the station level. And that's why in this regime of this launching of the 15 tractors and their non-tipping trailers, they are all targeted to go to the forest stations. That's where the seedlings are produced. That's where the basic nursery infrastructures are happening. And we want really to encourage and work together with the forest station managers to feel that they actually the people who are behind the successes that we are making as a Kenya Forest Service, of course with the supervision of other senior managers across the Kenya Forest Service. You would appreciate, and it's good to say, that as we continue to pull these tractors into the field, we know they require drivers. And that's why I said we have used a holistic approach. That's why last financial year, we were able to bring on board about 57 drivers and plant operators, because it will be very difficult to bring tractors without drivers, and then you have efficiency. And also as a station level, to ensure that there is proper administration, we are also able to bring on board about 143 record management staff to be able to administer at that office at that level. Bring about 26 motor vehicles, those are pickups. Again, they will go to the station level, and also about 45 motorbikes. Again, going to the station level. We must make our stations center of excellence. What we have done in the last couple of years is also to refurbish our tree nurseries. We have about 300 tree nurseries across the country. We were able to do in the last 2 years, about 143 of the stations have been refurbished. We have seen high level of seedling production in the nurseries. We want to enhance that capacity, and that's why these tractors are strategic to ensuring that we increase the seedling productivity and the nursery, but also sustain and help us to replant our degraded areas. So they will be very critical in terms of dealing with the issues of soil movement in the nursery areas, other operations, but more so seedling production. As we speak today, and for this last 2 years, it means then that the project have injected about 61 vehicles. That includes 26 double cab. It includes about 4 trucks. It includes about 2 minibuses to be able to ferry and have an exchange program for the community forest associations. We now have these 15 tractors, and now we are expecting another 26 motor vehicles and also another 45 motorbikes. That will bring us to a total of about 61 vehicles and 45 motorbikes. This all to support us to achieve our mandate and go toward achievement of the 10% forest and tree cover. And therefore, this morning is a great morning, Chairman, that we can see that a project can make a difference, not only within the Kenya Forest Service, but to the communities, because we need the goodwill of the communities around there. When I traveled and I have launched, and the project manager have said, to launch some of the income generating activities, it is so fulfilling to see small amount of money being injected to a small community, and that community's life have changed. I have seen potato production, and a farmer could say they are able to get almost 300,000 in a year from a small plot of forest land as they support us in establishment of the plantation. I could see some fish ponds, and the farmers, I saw one farm, Jokeni West CFA, having actually employed and having their own management system, a procurement officer. That tells you how serious that CFA is. We have seen ecotourism facilities thriving, and therefore it's a conviction that as Kenya Forest Service, we continue to increase our effectiveness and delivery of services. We also need to carry along the community's aspiration so that we can work together as co-partners in the management of forest resources. That's the only way we will be able to sustainably manage our forest resources. With those very many remarks, allow me to call upon my chairman to come and make his remarks. Thank you so much.
All right, so that is currently happening at the Kenya Forest Service headquarters right here in Nairobi. You've seen there the Chief Conservator of Forest, Julius Kamau, just talking to us about how important these vehicles are going to be in terms of forest conservation in the country. About 15 trucks have been flagged off this particular morning, and of course also talking about the progress that they've made as a team just to ensure that our forests are conserved in the country. We'll be getting more details in the course of the day. And right now also we have been following up for you the political happenings in the country. This morning the One Kenya Alliance was having a presser. We are just going to be crossing over to that particular presser that is being held by party leaders of Ford Kenya, Amani National Congress and Wiper Party. Let's listen into what they have to say, and then we come back and continue with our conversation. All right, we'll be going there later. Right now, we've been talking about matters COVID. So COVID-19 in the country. And before we, took our viewers to those particular links, Peterson, we were just talking about the spread of this particular virus. And I just wanted us to sort of dissect the recent, we've seen quite a number of political rallies that were lined up by political players in the country, and this, even the Ministry of Health the other day termed as a danger zone, and actually something that sort of, risked negating the gains we had made in the war against COVID-19. What would be your sentiments about why this is happening at the heart of, such a pandemic?
I think this goes far to show the kind of leadership that we have, that we do not have responsible leadership. Because responsible leadership means that before I look at my own interest, I want to look at the interest of the person that I'm seeking to lead. And what we have seen over the past several months is that our political leaders do not care about the people that they are seeking to lead. Because when you bring them together, and without even the containment measures, and you are encouraging transmission of this virus amongst the people you are telling us you want to lead, then that is not responsible leadership. But on the other side, this Kenyan who is attending these meetings,
I was about to ask you, are they innocent in this?
It also tells you something, that these people do not feel that they actually own the containment measures, and they do not hold them with the seriousness they deserve. So that tells you that there is somewhere that we are failing, and especially as the Ministry of Health and the county governments. And I must say that we are working in a very difficult environment where the health is devolved, and we have so many centers trying to do something, and sometimes we lack coordination. When you are dealing with a pandemic of this kind, there are certain things that must be in place to ensure that you have a whole community approach. And these things are, number one, you must have enough capacity to ensure that you can be able to isolate and treat the people who fall sick. Number two, you must be able to reach to the community mobilization. You must do proper, robust community mobilization. This is what we are lacking. Then you must be able to do surveillance. You must be able to do surveillance so that at any given time you can be able to tell which parts, and in these parts what percentage of people are we having, and so that informs the containment measures and whether you are going to limit more in some areas more than the others. Now the problem, especially when you are feeling in the community mobilization, and this is where I think we have failed much as a country, especially looking at how we started. We were enforcing using police. We decided to police these protocols instead of sending the people who are experts, the public health experts, to the community to talk with the community and sit with them, make them understand, and even make the community be part of generating these containment measures so that they feel ownership of these measures. And that is where the problem now lays. Because you can see, if you're walking in the streets, you're having some people wearing their masks, but they are on their chins. Because they don't feel that they actually need that mask. They feel that it's the policeman who needs to see them wearing that mask. And that is a failure. It's a failure of how we are taking care of our whole community approach, and especially that pillar of community mobilization and communication. Community mobilization does not end at informing the community. You must be able to go sit with the community, talk in the language they understand, make them feel according to their own logic, and so then they can be able to understand and own and utilize. And if that does not happen, they will continue going to these political rallies, they will continue getting infected and dying, and it will be a whole circus.
Hasn't that been what the Ministry of Health, hasn't that been what they've been doing all this while, telling us how serious this situation is, warning about laxity in terms of observing these protocols, just telling us about even the situation in hospitals and how we are having an overwhelmed health system. How should this message then be different, so that people can really understand that it's not about what the government wants to do, but it's about what I can do myself to be safe? Isn't that what not something that they've been doing all this while? From where
I agree that there is something they have been doing.
Yeah, telling us about how serious the situation is.
But how far does that communication go? Which languages do you use? How do you deliver it? How many people will be watching news at 7? What percentage of Kenyans? And what percentage will be out in the market trying to earn a living and are trying to sell their wares until 10 p.m.? How are they going to get this news? And that is why sometimes you just have to have the experts on the ground, not even through the media now, on the ground talking with people. I'll give you an example of West Africa, because I went there when we were fighting Ebola. And we regularly and constantly had a communication and community mobilization team out there with loudspeakers, with pamphlets, with everything that you need, the IACs, so that they can engage the community. You can sit with them, you can be able to approach them from where they are, you can be able to reason with them. Our logic is very different. How you approach the middle income society is not the same way you're going to engage with the lower income community. And what they consume in terms of news, in terms of the languages they use, it's very different. So you must have some people with a local touch, the people they can be able to believe, constantly and regularly engaging these communities so that they can be able to own it up. But when you tell them how serious it is, sometimes they will not understand, because you cannot be able to show them what is happening in hospitals. And sometimes for them, we are a very political country. Some of them think that you are playing politics. But when you bring people who are apolitical, who they believe they are experts, of course they are going to understand and believe more.
All right, we get your point. So a change of strategy is needed. Constant, I've heard you talk about constant communication, and then how we communicate this information should actually change and cater for those who are in the low income society. Maybe even translate this into their vernacular, languages, get to their houses and get people who they can identify with in their communities to break this down for them. I like that approach. I also want us to talk about now the situation in our hospitals. You are the frontline soldiers in this battle against the COVID-19 pandemic. The Ministry of Health is telling us things are not very good. The CS the other day was actually saying that if you get sick today, you're highly likely to miss a bed and to miss, the oxygen ventilators. Tell us, how bad is the situation across the hospitals?
And I think that was very sincere from the CS, and I can assure you that that is actually the case. And in the next 1 to 2 weeks, actually, I don't think within the metropolis you'll be able to even get a bed from any hospital. I have had relatives that have been trying to secure beds for, and we have had to settle for some private hospital somewhere because we couldn't actually be able to get any in the public. And sometimes even the quality you are looking for, it's not easy for you. But where did the rain start beating us?
Exactly.
as a country, I think we must own up to the challenges that we do have. I think prior to I think the last decade, there was a general neglect to the health sector. I think it's fair for me to say that. And this I mean, we didn't have enough resources in terms of the expertise, the skills. We didn't have the equipment, and we didn't even have the infrastructure. I think it's the first time that we are seeing a government put health as one of its agendas. We didn't see that in the past. And I think we must give credit to the current administration under His Excellency Uhuru Kenyatta, because they have tried to do something. So what we had is that the equipments were lacking. That is why by the time we were being hit by COVID, I'm telling you the number of ventilators and even the people we could give oxygen, just oxygen, which is a normal thing, it was very little. The other thing is we have a dire shortage of human resource. And you know, even according to WHO, they will tell you that there are 6 or 8 systems, depending on where you are looking at it from, that make a good health system. But within that system, the human resource is the core system that runs the others. Our own government and our ministry has owned up to the challenge of a dire shortage of human resources. It is documented in government documents. In fact, in 2013, Kenya was represented by the CS Health then, CS Macharia, in Brazil, in a WHO Human Resource for Health conference. And Kenya owned up to the dire shortage and the fact that it may prevent Kenya from offering that universal health coverage. And so the CS made certain commitments that you can actually Google and see, and they are signed, that in every year, Kenya is going to employ 12,000 healthcare workers, and these included doctors, clinical officers, nurses, pharmaceutical technologists, laboratory officers, nutritionists.
So that was to happen annually from 2013?
Annually
when
from 2013 to 2017. Or
to 2017?
Yes.
Have we done that?
If you can sum up the numbers we have employed since 2013 to now, currently 2021, they do not even aggregate to the numbers of 1 year as Kenya committed. Following that, in 2014, the Ministry of Health domesticated the same in what they call staffing norms and standards. And they provided on how they were going to increase the numbers so that by 2018 they would achieve that. For an example, to bring it home, for just clinical officers, they were supposed to have 16,148 in place. Currently, we only have about 6,500. We are not even halfway what we committed as a country.
So how is this impacting the quality of health, health services that we're giving our people? We'll be picking up this after this. How is this shortage, affecting us? We're just going to be crossing over quickly to that press I told you earlier, the One Kenya Alliance press. Currently speaking is the Wiper Party leader, Kalonzo Musyoka. Let's listen in.
That clarion call is already protected under intellectual property laws of this country. And so it's a serious business. Na kutoka sasa kuelekea mbele ijulikane na wananchi wote wa Kenya na hata marafiki zetu duniani kote kwamba muungano wa One Kenya Alliance tuko imara, tuko tayari kuchukua uongozi wa nchi hii ifikapo mwezi Agosti mwaka ujao. Na katika matamshi haya hatuna chuki na yeyote yule, bali tuna imani kwamba Wakenya watatuunga mkono, Wakenya wazalendo, mwamko mpya. Na kwa hivyo kwa pande wetu, kama ambavyo nimesema, hatuna takshishi yoyote, hatuna ugomvi na yoyote yule. Ugomvi ugomvi ambao tunao ni dhidi ya ufisadi ambao umefikia kiwango ambacho hakieleweki. Tuna ugomvi na wale ambao hawataki nchi hii mema, na tuko na ugomvi wa ajabu na wale ambao wanataka kusambaratisha umoja wa nchi hii. Tutaelekea katika kila sehemu ya nchi yetu hii. Wenzetu katika mlima Kenya tunajua kwamba walikuwa wakisema wapi wakilishi wetu, na najua wako tayari. Wenzetu katika eneo la Pwani na sehemu zote, muungano wa One Kenya Alliance ni muungano wa wananchi wa Kenya na ambao wako tayari kutimiza kwa njia dhabiti uongozi bora wa nchi hii. Hatutaki kuzungumza juu ya bottom up ama wide upside down, mambo kama hayo. Tunaelewa kabisa uwezi ukazungumza juu ya economic models. Wakenya watakumbuka kwamba mwaka 2007 mimi kwa upande wangu nilianzisha mwito wa kufanya kazi 24 hours, 24-hour economy, na bado tunatoa mwito huo ili kuboresha uchumi wa nchi hii. Tumetoa mwito hata juzi tukiwa Pwani kwamba bahari ya Hindi na Porto Mombasa yetu ile na pamoja na Lamu, huku tukimpongeza. Nilisema wazi, mtu akifanya jambo la busara apongezwe. Mheshimiwa Uhuru Kenyatta alipotangaza kuanzisha rasmi Lamu Port, alifanya jambo la maana ambalo aliyemtangulia rais mstaafu Mwai Kibaki, mimi nikiwa makamu wake, tulianzisha mpango huu wa LAPSSET. Na kwa hivyo ili nchi hii jimudu kiuchumi, and all those tractor drivers wanaofanya kampuni za logistics ambapo ameadhirika pakubwa kwa sababu ya kuwepo kwa standard railway gauge. Imagine a situation kwamba Port of Mombasa and Port of Lamu zitakuwa port huru. Kuna I can tell you that kwa upande wa Uingereza kwa mfano, Prime Minister Boris Johnson.
All right, and the road to 2022, that is how it looks like. This particular morning, the One Kenya Alliance has just categorically stated that they are ready to take over the leadership of this particular country come 2022. I'm talking about leaders such as Kalonzo Musyoka of Wiper, Moses Wetangula of Ford Kenya, and the ANC party leader Musalia Mudavadi. Also, we have from the KANU front, Gideon Moi. It is a matter of wait and see. A lot is happening already in the political space. We will be engaging on this and much more in this second interview that is just about to start. But in studio, we have been talking about the COVID-19 pandemic. A lot seems like we have a lot of ground to cover going forward. We have quite a number of hits and misses here and there. And I've been having this very important conversation with Peterson Wachira. Peterson is the national chairperson of the Kenya Union of Clinical Officers. Thank you for staying on, Peterson. And we were just talking about the status in the hospitals and how bad the situation is. And you cited a big problem, the shortage of the human resource in our hospitals in the country. And I wanted just to understand how this translates to our ability to offer quality healthcare to the populace, and especially at the heart of such a pandemic. How serious is a problem of having a shortage of staff in our hospitals when you're battling such a pandemic? Yeah,
I think now that is what actually brings it home.
Yeah.
Because what happens is, number one, you have a shortage of human resource. That has consequences. One of the consequences is that you will not have enough people going back to improve on their skills and specialize. So you have a few specialists. Number two, the people that you are having seeing your patients may not actually be able to give the best they can. And in some point, they are either going to misdiagnose or they are going to miss a diagnosis. They give a wrong diagnosis or miss a diagnosis that is there. And I want to give you an example of my own father. You remember we went on strike last year and we were simply telling Kenyans that we are doing this so that you do not have to die. The very reason that I led my people on strike so that the government can sort actually came home to haunt my own dad. So my father goes to three different hospitals. Assist to clinic officers, is seen by a doctor, is seen by several nurses and a nutritionist over 3 days. None of them would actually pick that this 77-year-old man is having difficulties in breathing, something that you can be able to see from afar. So I actually noted from the phone, and I told him, no, you are not okay. And I took him from home, took him to hospital and told them, you have to test this man for COVID. And by then...
So you're the one who demanded for the test to be done, the COVID-19 test to be done?
I actually left Nairobi to Nakuru, where my father lives, took him to hospital, a public hospital, demanded for that test to be done, because I could tell from the phone that he was actually gasping. Sometimes he would actually pause to catch his breath. So it came out positive. Unfortunately, even my mother came out positive by then. By then, my dad's lungs had been destroyed 68% as per the CT scan, and his oxygen saturation was around 56. So what would have happened had I not intervened? He would actually have collapsed in the house, because he was just sleeping in the house. And by the time I was actually going to take him, he could not recognize me until I talked. So he could have just collapsed and died in the house. And so, as a responsible leader also, I wanted to just know, why would all these medics would have missed such an overt symptom or sign from such a patient?
What were they telling you?
And so I decided to go and interact with them and just experience the environment. And I'm telling you, I found a clinic officer in a day seeing about 130 to 150 patients. According to the World Health Organization, you cannot be able to see more than 35 patients in a day. So this is even more than double. Above, you are actually just clearing and forwarding. You want them to just get out of your space. And so you're already fatigued. You cannot even tell, because the moment that patient is coming in, you want them out. You want to clear the line so that you can actually relax. And that is where the problem is, that actually some of the cases, because we have so many cases who have collapsed on the streets, at home, and I know them. I saw them in Nakuru. I saw them even in my home area. People who just collapsed, and they were later diagnosed to have died of
COVID-19. First of all, sorry for what happened to your dad. Yes. But I'm trying to imagine, for you, you're lucky you were a medical expert, and probably you could tell that something was off over the phone, and you traveled to go there and find out. But how many Kenyans are in that particular position? What could be happening elsewhere? Somebody who cannot even be able to tell, like yourself, who is a medical expert. Does it mean that we have so many of such cases in the country?
And actually that is the point, that if you have a shortage of human resources, because sometimes Kenyans do not understand, those are the repercussions that you are going to get. For those who do not understand, who will not get a medic to be able to intervene and save them, they are collapsing and they are dying at home. And it's something that is there. It's something that Kenyans will be able to tell you that they have actually experienced the same. Some of them are actually being taken to hospital in the last stages, when they are very bad, and sometimes it's very hard for them to recover. So when we as the unions, we go out and we try to get the government to employ more, we are not looking after our own welfare. We are looking at an ideal situation where we can be able to offer the best quality of healthcare to Kenyans, as envisioned under Article 43 of the Constitution. And sometimes Kenyans mistake us to be entitled. And actually, going forward, if we have real human rights activists, we should see human rights activists, especially now that COVID has actually portrayed the importance of the health sector, especially in the progress and development of a country. We need to see groups that are non-medical, that are now taking up activism to ensure that we have everything we need in the health sector, so that Kenyans can be taken care of.
All right.
As we head to the UHC, we cannot be able to achieve universal health coverage if we are not going to have the requisite numbers in the right skill mix that we need so that we can be able to deliver access to all Kenyans.
All right. Yes. Peterson, as you're about to wrap up this conversation, what about now the welfare of the frontline soldiers? There was a time, and I believe you really advocated for healthcare workers to work in conducive environments, especially right now. They were decrying of lack of PPEs. You've just talked about the shortage that comes with fatigue and all that. Have things improved?
Things have not really improved, and it's unfortunate to say that in Vihiga we have about 122 officers who have been serving for the last 2 years without salary, despite a court order directing the county to pay. We still have officers in Kisii who were actually dismissed from service because they asked for PPE during the last strike that are not yet back, yet we are having a shortage. Then, you remember that we entered into an agreement with the Ministry of Health. That agreement was giving us a comprehensive medical insurance cover that caters for you when you fall sick, and a comprehensive group life cover that compensates your family in case you pay the ultimate price. The counties declined and refused. So as we talk now, the counties do not actually have a comprehensive cover for their people.
So if you're a healthcare worker, if you fall sick today, what happens?
If you are under the counties, then we are having to contribute, and we have them actually. We are having to contribute, and this is a simple thing that a government can be able to do even through the NHIF. But the governors deliberately decided that they cannot agree on those aspects, and that is why if the situation continues like this, you will see a lot of lethargy, especially in the counties. In the national government, the CS for health signed, and we are covered, we are completely covered, including those who are on short-term contracts. But under the counties, if we get several people falling sick, God forbid, we get somebody dying. We have already lost. We lost a lady from Mombasa. I know from Kajiado, we are having a lady who was pregnant, and now she is hospitalized. She's actually in the ICU together with the child because of COVID. She's a medic. She's actually a clinic officer. If these things continue and we do not have the requisite covers, I can assure you, you are going to see people deliberately refusing to go to work because they feel that the government has not protected them enough to be able to treat Kenyans.
All right. Yes. I want you to, if you're given a chance to sit down and advise the government on the way forward on this, we are not looking at a very promising positivity rate of 12.5%, and it could go higher, it could go, lower. It depends on how best we are going to manage this pandemic. What is it that you tell us to do different? What are some of those things that you'd list and say, let's do this for us to be able to manage this pandemic?
Very good. I think what I would say, number one, let us ensure we have a whole community approach. How do we ensure that? We do enough community mobilization and communication. And by the way, community mobilization does not stop at mobilization, at communication. You deliver the information, but there are other things you must do. You must ensure the community understands that they have to take care of each other. Until you reach that point when your neighbor asks you why you're having so many people over and you're going to get infected, or why you don't have hand washing, then you know there you're achieving something. Number two, you must take care of the healthcare workers because they are the first and they are the last line of defense when it comes to a pandemic like this. How do you take care of them? Ensure you have enough numbers, because we do not have a shortage of healthcare workers in this country. We only have a shortage of recruitment of these healthcare workers. And I'm surprised that now we want to ship them out instead of first ensuring that we have enough in the country. Number two, can you ensure that their welfare is well taken care of? They are well sensitized, they have the requisite medical cover, the group life cover to compensate in case they die. And lastly, can you make them feel appreciated when they ask for protection, like what we did last year? That is not the time for government to come out with batons and hit their own soldiers who are fighting. That is the time to sit with them, understand them, and reason together with them, because these are the experts, and ensure that you employ the expertise that is needed. We have a very great shortage also of the public health workforce. And these are the people who are supposed to be out there in the markets, in the streets, doing this community mobilization.
Thank you so much. Thank you so much, Peterson. Of course, this is a conversation that we cannot conclude in one sitting. It is something that we really need to, keep on empowering the populace about. Thank you for creating time and the much that you've shared with us on how best to battle this pandemic. I've been engaging Peterson Wachira, the national chairperson of the Kenya Union of Clinical Officers. Thank you once again for your time. In just a bit, we are going to be shifting gears and talking about the politics that is shaping the country, and I will be engaging political analysts in studio, Michael Agwanda and Edgar Willikos-Gay, in just a bit, so that we can dissect this particular matter coming up in just a bit. We are taking a very short break. Newscheck continues in a short while.
Get the VIP access to the best shows on KBC Channel 1. We have something different, something special to spice you up. Get ready for new, exciting and captivating dramas. Movies.
I love the smell.
Comedy.
I went to the popos. Huh?
Drama.
Will he assault the queen in my house, in my presence?
News, sports and so much more. Do the things that make you happy on KBC Channel 1.
Nissan Serena ndio hii, na unaweza kuwa wewe ndio tunapikia simu. Kodi ya Nissan Serena ni NS, alafu kisha kwenye amount ni 50 bob. Hii Nissan Serena tunakupatia na shilingi 50.
Kujiunga na QuickBid ni rahisi. Enda kwenye M-Pesa, bonyeza paybill, kisha weka business number 4032353. Kwenye account weka kodi ya bidhaa unayotaka na bidi yako ya chini zaidi. Kwa mfano TV 16, kisha weka shilingi 20 tu kama idadi yako. Weka bidi yako pia kwenye www.quickbid.co.ke. Kumbuka, bidi ya chini zaidi ya kipekee ndio hununua. QuickBid, bidhaa bora kwa bei ya chini.
Why you would protect Han Yunxi even though she is a spy for Queen Mother?
How will you repay me?
Just name it.
Who is trespassing in my manor?
He must have a greater purpose. I will continue investigating.
He wouldn't think that I am having an affair, right?
He does really care a lot about you.
Oh no, the Crown Prince asked Gu Qishao to investigate the powder that he switched. Do you know what the powder was?
Sinking sun, Jamaica wanna get him from human race, turning in a human race, yeah.
Don't they know thy will always be done?
Ay, otra vez vamos a hacerlo, pues. Ay, vamos a hacerlo, pues.
right, welcome back and thank you so much for staying with us. So on the first hour of this particular show, we have been talking about the battle against COVID-19, and earlier we took you to Mombasa County to understand the situation there. Right now, we also want to know what is happening in Kisumu County as far as this battle is concerned. And now joining us live is our reporter based in that region, Wycliffe Okech. He's going to be engaging the Kisumu Health CEC just for us to understand what the county is also doing to manage the spread of COVID-19. It's over to you, Wycliffe.
Well, that is very true, Serfine. While you're in studio there, we are here in Kisumu. You do know that the country's fight against COVID-19 is still continuing, and the Kenyans cannot manage to lower their guard at this particular moment. And you do know that Kisumu is one of the 13 LRIP counties that had been marked earlier on as the COVID-19 hotspot. But in the recent past, the COVID-19 numbers in Kisumu have reduced tremendously. The reasons behind that, I'll bring on set the County Director of Public Health and Sanitation, that is Mr. Frederick Olwach, who will try to explain, just give us a hint into the county's response to the infection rate and more or less the ongoing vaccination exercise, and what the level of preparedness of the county to the imminent fourth wave that had been predicted by the Ministry of Health. At this point, allow me to bring on set the County Director of Health, like I said, that is Mr. Frederick Olwach, probably to put this into perspective. Fred. Thank you very much. This is you're live on KBC Channel 1. We're just asking, could you put for us into perspective the status of COVID-19 situation in Kisumu? We've seen in the recent days the numbers have reduced. What do you think is the reason behind that?
Thank you very much. I'm Frederick Olwach, Director of Public and Sanitation, Kisumu County. It is true that our numbers have gone down from, we had a very high positivity rate, around 28.9, and now as we speak, we are at around 6%, and we're still going downwards. So that means over 60,000 tests that we've done, cumulative, we've had 6,338 positives, and what we have now currently, we only have 45 people who are positive in the county, and 30 in home isolation and only 15 in hospital isolation across the county. So that means it reflects on our positivity rate. If I talk of 6, I know it's going down, and very soon it will go below 5% completely, and this one is attributed to the enforcement measures that we put in place, the public health preventive measures, awareness campaigns that we're putting in, sensitization, and of course people are adhering to the measures. They're making use of masks, they are washing their hands, they're using hand sanitizers, and of course social distancing also there. So we've been really very vigilant, and of course there are issues like burials and also night vigils, which were of course night vigils were of course stopped, so there are no such. And also we are also getting into the funerals, both the national government and the county, and making sure that they comply to COVID measures, and also issues of gatherings in like bars, and also even places of worship which were also closed. So the bars also, we go there and we make sure that there's compliance. And I think now people are not mixing, and those who are positive are also being monitored. We do contact tracing and of course home follow-ups, and make sure that they adhere to home-based isolation care, and that attributes the low numbers that we have now. Yes, thank you.
And talking of that, you do know that Kisumu is a very central place in the western region, considering the status of Jaramogi Oginga Odinga Teaching and Referral Hospital that is actually providing referral services to the neighboring counties. The 35 positive cases that are currently in Kisumu, do you think they are within Kisumu, or they have been referrals from neighboring counties?
So of course I want to confirm that these 35 are within Kisumu County, and the ones in Austral, some might have come from outside Kisumu County, but now they are within our hospitals within Kisumu County. So it is true that some are coming from other counties, but now we consider them ours because they're in Kisumu County. I also failed to mention that the positive impact of curfew on reduction of COVID cases. I think most of our cases are attributed to the fact that there was curfew and people could not interact a lot during night hours. And I think that also contributed, also together with public health and enforcement measures that we put in place. Thank you.
Well, by the time the government was revising the containment measures for the 13 LREB counties, oxygen supply was a concern. How is it now in Kisumu especially?
Well, in Kisumu County, oxygen supply is not a problem now because we brought in, of course, we had 2 BOC liquid oxygen installed at UTRH. We also had an oxygen generating plant, which was initially producing 375 liters per minute. The county went further and installed a new oxygen generating plant at UTRH, which is adding in 600 liters per minute. So if you add that to 375, that means that we now have a capacity to produce 975 liters per minute. And of course, we're also installing another liquid oxygen tank at Kisumu County Referral Hospital. So we are not, I think we are better off with oxygen supply as compared to previous situation. Yeah.
In the last address by the Minister of Cabinet Secretary for Health, that is Mutahi Kagwe, he talked that he urged the KEMS actually to do business with counties in terms of oxygen piping, even regardless of the probably disbursement that are still pending. Does that mean that the county, Kisumu especially, is in a good position, probably doesn't need an input from the KEMS at the moment?
Well, thank you. I mentioned that you see the liquid, actually the support was coming from the World Bank through the national government. And there's already the Kisumu County Referral Hospital, the liquid oxygen tank that I'm talking of, is a support from the national government. And that's why the installation is still going on. And that means we still need support from the national government because whatever we do in collaboration with them and with their support. Yeah.
Could you talk to us briefly about vaccination exercise? How is it so far?
Well, initially there was, of course, hesitancy in terms of consumption, but as I'm talking now, there is high demand for COVID vaccine in Kisumu County, and so far we've vaccinated, like the first doses we gave 36,000, and second doses we had 17,000. And of course, we received around 55,100 vaccines, so 51,500 vaccines. So, what we can see is that people are still getting vaccines, and there is high demand for it. Yeah, the risk behavior, the risk perception is very high, and they know that given what they've seen there before, the high positivity that was there, everybody wants to get protected, and there is high demand for vaccines.
That is very positive. And just finally, probably in the face of the imminent fourth wave, how prepared is the country? Do you think the country is in a better position to handle, especially the Delta variant that has now been predicted to be dominant in the country?
Well, we are very, very much prepared. Because of course we had seen a surge in cases, and we prepared our team. We expanded our bed capacity. If you go to GTRH, you realize that we added another 80 bed capacity there, and of course there was the initial one that was there. At KCRH also we are putting in oxygen, and we're also expanding the capacity there. And I think as far as we're concerned, up to now, we are well prepared, and we are on track to make sure that we train almost everybody to be ready so that they can rotate and support the isolation ward if the cases start rising.
Thank you so much, Bwana Director. Serfine, that was the Director of Public Health and Sanitation in the county of Kisumu, Mr. Frederick Oluoch, just putting for us into perspective the COVID-19 situation in the county. Do realize that in the recent days, the COVID-19 numbers in Kisumu have reduced tremendously, and just like the Director put it, this is due to the containment measures that had been placed on the 13 elderly counties, including Kisumu, that has now since been revised due to the decline. And just like you heard from him, the county is in a better position to respond to the imminent fourth wave that had been predicted by the Kenya Medical Research Institute. And he says that especially the public hospitals in the county, that is including the Jaramogi Oginga Odinga Teaching and Referral Hospital and the Kisumu District Hospital, they are all equipped to respond positively to the imminent fourth wave, given the domination of the Delta variant in the country right now. This conversation is not ending here. I'll be engaging in more, and we will be updating our viewers in our subsequent bulletins. Serfine.
So that is Wycliffe Okage coming to us from Kisumu County, just, sort of looking at the progress that has been made in the battle against COVID-19 in that particular county. He was engaging Frederick Oluoch, the CEC, Public Health and Sanitation in Kisumu County, a county that was the very first place where the Delta variant of the COVID-19 was reported, and of course also falling among the counties in the Western region where we saw a heightened implementation of the COVID-19 containment measures when the cases surged in that particular region. But things seems to be improving as the county government there reports, and we will just be, we're following up this particular story for you as well, because that is what we were focusing on the first hour. But allow us now to shift gears, and my guests in studio are already with me this morning. Edgar Willie Kosgei, a political and public policy analyst. Thank you, Edgar, for coming. And of course, we have Michael Agwanda. Michael is a governance and leadership expert. Thank you, Michael, for creating time. Today, we just want to look at the state of the nation, politically speaking. A lot is happening. This morning, we just saw the One Kenya Alliance having their presser. And Wiper Party leader Kalonzo Musyoka, they are very categorical that they are ready to take up the leadership of this country come 2022. I will be asking you whether the One Kenya Alliance is the next thing that we should be looking at as we head to 2022. But I just want to take this to the genesis where it all began. So right now, there's a lot of talk about the NASA divorce and which way NASA. Michael, just to start with you, did we see this coming? For a very long time, this house was in order. From the last general election, things seem to have been planned. There was an agreement, a gentleman's agreement, that it was Raila, then somebody else come 2022. What happened? Did we see this coming? Did you see it coming yourself?
I saw NASA disintegrating. I saw NASA coming to an end. What I did not see is the relationship between these principles, as you may call them, of NASA sort of, disintegrating. And I believe that is not going to happen in the near future. What has come out in the public is there were wrangles about financial misunderstanding. And I think Honorable Kalonzo Musyoka has come out very strongly and said that there was some financial agreement that were put in place, and the instrument was deposited with the registrar of political party then. But then there is also the other aspect of argument coming from ODM party, saying that indeed there was an agreement. However, the agreement was up to the point where the presidential aspirant then, who is Honorable Raila Odinga, clinching the position of presidency. Unfortunately, that did not happen. And so that sort of voided a lot of the agreements that were therein. And again, when it came to the issue of money distribution that came from the exchequer, that money was based on representation of individual political parties to benefit from it. And to that extent, ODM and Jubilee have been the beneficiaries beneficiary. Lately, as we've seen ODM saying that indeed they've come to an agreement that there will be part of payment that will be going to other parties. However, they're also alleging that the government of Kenya has not given them close to about 7 billion for that reason. So as much as the other affiliate NASA partners are saying that they need to get the money, they're also alleging that not all the money has been given to ODM for that reason. And that to me brings me to this point where I'll say, if it was the money issue, then perhaps it will not be resolved soon, because maybe what has been given is perhaps what they will be looking into. The big chunk of the aid is yet with the government, and that will take a while to resolve.
All right, Michael, is it a money issue or a political issue if you look at this divorce, Edgar? And the promise that it was Raila,
yes,
and then he will endorse somebody else next time. Is it about that, or is it about the financial aspect of it as brought about by Michael?
All issues have been brought together to the table. It was agreed that Raila Odinga was going to run, and then he was going to leave it to other people also to test the running or to the presidency. But now that Raila has not been able to clinch the presidency, then he has to try it again. He has to come again and try it. So that has brought war between among the leaders of NASA. It is not just about the money. It is about the future of their coalition. Mudavadi feels that he has to have a chance also to lead their side of their coalition. Kalonzo also feels that he should be given a chance, and Raila feels that he should still be given a chance because he has a huge following. Mudavadi doesn't have a huge following. Kalonzo doesn't have a huge following. They still need Raila in their camp. That's why the newspapers yesterday were saying there is still a shadow of Raila in the camp of Mudavadi and Kalonzo. Okay, so it is not only about money sharing, though it can also that can be a major issue, but it is about how do we move forward that all of us share in this cake of running for presidency.
All right.
Yes.
The divorce seems to be, it has not been formalized though, because the registrar of political parties has been categorical that she has not received any written form of documentation to show that this coalition is no more. But we have seen it in the public domain, these parties, publicly declaring their exit. We began by, we saw the ANC party, Wiper party the other day. The latest was Ford Kenya. First of all, why is it taking them too long to just formalize it on paper from where you sit, Michael? And should we be looking at the One Kenya Alliance as the next big thing? Because these three parties sort of have marshaled their support together and they're working with the KANU party in this One Kenya Alliance. Could it be the next force to reckon with in 2022, minus Raila?
I want to say something here, that the One Kenya Alliance is built between Honorable Kalonzo Musyoka, Musalia Mudavadi, Honorable Tangula, as well as Gideon Moi. Honorable Gideon Moi, however, has come out very publicly and said that he cannot dissolve their relationship with Jubilee for that reason. That means that One Kenya Alliance is a loose network. It is not yet having instrument of commitment as a coalition party or a conglomeration of other parties coming together within the instrument that NASA had. So I think it's still a loose network that we're talking about. There are members there that really, other than being friends and saying this is what we think, they have not put pen to paper and say this is the sealed agreement that we have. And if Honorable Moi is still saying that I am not going to sever my relationship with the Jubilee, that means it has to wait. What I have to tell you, Serfine, is there's still gonna be a huge collision within the parties and without the parties. What we're seeing as One Kenya Alliance is not necessarily the last of it. And as people have said, One Kenya Alliance is not One Kenya Alliance without Honorable Gideon Moi. And if Gideon Moi pulls out of it, then the rest of the people will be left bare. Again, there was no, sort of a collision of parties coming to make the next government without one William Somaya Ruto and one Honorable Raila Amolo Odinga. It could be that William Somaya Ruto will be in a different end and Raila Amolo Odinga will be at a different end, but the team you want to watch
they cannot be underestimated.
They cannot be underestimated and you cannot run without them in this country. That means one team will have to be in the Ruto camp and another team will be in Raila camp if he's running, but that we haven't seen. So because they have not decided which team to join or who joins them, I tell you, where they stand, they will be the ones to be joined, not the other way around.
But you see, they seem like they have already made their decision. I mean, they've decided to join each other and they're actually having a coalition. ODM is still looking, still shopping for a coalition. They've not stated where they are going come 2022. I don't know whether, what you feel. I saw your body language there when Michael said that, you cannot underestimate the Deputy President William Ruto and Raila Odinga. What do you think? Is One Kenya Alliance the next big thing as we speak this morning?
I agreed with him in many instances. One I want to emphasize is about Gideon Moi. Gideon Moi is not committed to this alliance because their relationship is still intact with Jubilee and they are not going to dissolve it. I don't know whether I should predict this, but Gideon Moi has one leg inside and one leg outside. Maybe because he wants to see whether they have a chance. Where President Uhuru Kenyatta is going to support, that is the place which is going to matter. Right now, President Uhuru Kenyatta is in talks with ODM leader Raila Odinga. Raila Odinga is coming up with a strategy of going around the country to woo as many people as he can. He is going to ask the people to come up with points of how they are going to develop their regions. He's going to start with Kisii, going to Homa Bay and coming to Kakamega, up to Nairobi, to northeastern, eastern. Raila Odinga knows what he's doing. He's going around the country to bring himself people and confidence in the nation. Gideon Moi is still looking whether to join Raila Odinga. Raila Odinga's camp is the one that will matter in this race. And One Kenya Alliance might come together with Raila Odinga if they agree to the terms that Raila Odinga is going to be the flag bearer.
Should he be? And is it finally becoming clearer whether he's going to vie? Because we've been having this conversation and nobody seems to be sure whether he has really declared publicly he's going to vie or not. Is it becoming clearer?
Raila Odinga must run so that we will have a competitive group. Otherwise, if we bring any other person who is in the One Kenya Alliance or Gideon Moi, then we will not have a competitive group if they come together anyway. But Raila Odinga must run, and he has indicated now that he is bringing people together. On the other side is William Ruto. William Ruto cannot come together with Raila Odinga. I'm thinking.
That's you saying.
I'm just thinking. Yes, it's my personal
day in
opinion.
Politics is such a long time. That's what we usually say. So
it's 1 year to go. It's 1 year to go.
Okay.
I'm just thinking, and I'm just. It's a wild thought because they have massive differences. We've seen yesterday what happened to the deputy president. The war and the fights are very high. And they are beyond. So them coming together will take another step that we have not seen here. Otherwise, the One Kenya Alliance and ODM might come together. There is a possibility. And Raila Odinga said that we are going to look for friends and we might even join them. And they also said that Raila Odinga is free to come and join us if he agrees to come as an equal partner. Yes.
But are we likely to see a NASA season 2 with this One Kenya Alliance? Because all these, core principles, they have their eyes set on the top seat. They want to be, the next president of this particular country. Nobody is willing to let it go for another person, at least for now. Are we likely to see a NASA season 2 post 2022?
Serfine, there's a friend of mine who says it's not what they say, it's what they do. When you see Honorable Raila Amolo Odinga saying, I'm going to traverse this country, I'm going to look for votes, I'm going to listen to the people. In other words, what he's saying is, I want to get the credibility from the people. I want to get the accolade from the people. On the other principles, sorry to say this, but other than their home turfs, there is no any other places they seem to have great influence, and any other place that they're planning to go to those people on their side. Let me give you a little bit. Honorable Raila Amolo Odinga comes from Nyanza, and his next home ground is Western. In fact, when he was the Prime Minister, he gave more attention to the people in Western Province than even in Luo Nyanza. There were more ministers from Western than the ones that were coming from Nyanza. And why did he do so? Because he knew that he already have a big following from Nyanza. He needed another second vote, and that was from Western, which is a neighboring country. I've asked this question. Has Honorable Kalonzo Musyoka gone to Central and said that if I ever run for president, this will be my second home turf other than Eastern? That he has not done well, other than the statement that he made that indeed the Mount Kenya region owes him something. What he owes him, I really don't know. What about Honorable Musalia Mudavadi?
He was in the Mount Kenya region for a tour the other day.
You can be in there for a tour, but has he asked them to, and is he assured even half of those votes? I can guarantee you today, if Honorable Raila Amolo Odinga was running, he will not just be guaranteed of 50% of Western voting bloc, but he'll be guaranteed of about 70%. That's really high there. But has Honorable Musalia Mudavadi also gone to Luo Nyanza or to Rift Valley just across there and said, I can command 30% of these people? But that you cannot do by sitting in Nairobi or being in Western Province. You can only do that when you're constantly visiting those places and telling them what your visions are and why they need to vote for you. Has he been to Mombasa for that reason? I mean, Honorable Wetangula, I know he's not going to run, other than the fact that he's running a party that seems to be slightly bigger, and hence the reason why he sits on the table with them. But remember that there are also two principles from Western Province. So when you see one Kenya Alliance, the question is it made of two people from the same community, and one from Rift Valley and one from Eastern? Is it a representation of the entire nation? Because we haven't seen something like what we had in the Pentagon in 2007. We haven't seen something like what we had in NASA in One Kenya Alliance. And for that reason, there are still a lot of teething issues. As much as they're saying that indeed I want to run for president for Kalonzo and Musalia Mudavadi, they have not come out to start asking people for their votes in 2022. Instead of holding conferences and speaking very nice English, of course they do, I want to see them go to the trenches of the corners of every place in this country to ask for votes. Then people will take them seriously. But if they're waiting for an endorsement, as many have said, it is going to be a tall order. But last, as I finish, I want to say this. I think it is in the interest of President Uhuru Kenyatta to leave this country undivided. And for that reason, they know that they need to be brought on the table. They're raising their stakes high, but they know that ultimately, if Honorable Raila Amolo Odinga is going to run, they cannot match him.
All right, Michael, he seems to have interpreted what could be happening there. It's all about raising your stakes so that you can have a say on the table, if I get you right. I don't know. What then, how do you interpret the Raila-Ruto equation then, Edgar? We've talked about politics of endorsement here and who owes who what, you know. This I will marry with the Mount Kenya region politics, because it seems to be centered around the Uhuru Kenyatta succession in 2022. That is the key issue in that particular region right now. If you look at how this is going to be played, what do you think is going to happen in 2022 when it comes to the Uhuru, to the Raila and Ruto equation in that particular political backyard of President Uhuru Kenyatta?
Raila Odinga has not found the right key for Mount Kenya. Last week he had visited Mount Kenya, and he had gone to the house of the Royal Media boss. He had gone to they had gone to celebrate the Skiza tunes, and they had gone to see how to help the musicians at the mountain. We want to see Raila Odinga with the people. And I don't know what is difficult for Raila Odinga to go meet the people, whether he is received or not. We want to see the Raila Odinga we know. The Raila Odinga that used to go to confront the crowd, that used to be with the people. Yesterday or the other day he said, I have not been defeated to climb the mountain. But the question is to the ODM leader, what is stopping you from going to the streets and negotiating directly with the people? Are you waiting for the president to hand over the mountain to you? Politics is a game of charm. You charm the people, sell your policies, give them what you have for them for the future, sell how you are going to deal with their children, sell how you're going to deal with their women and their youth, sell your policies at the mountain. Mountain is so critical because they have the numbers. William Ruto has tried. He has tried dishing out here. He has tried facing the people head on. He has tried meeting the tear gas on the ground. He has tried with the opposition, the Kieleweke team. He has tried. Where is the ODM leader? Or maybe he was promised that the mountain is going to be handed over to him. But how hard is it? How hard has it been? People have really rejected him. I don't know why. Maybe because he ran against Uhuru Kenyatta, and the forefathers of the Luo nation ran against the founding fathers. Such are small things to be resolved.
Do the people of this region owe anyone anything?
No, I don't.
Because that has been the bone of contention.
Certainly, we cannot blanketly say that he's been rejected in the mountain. We know very well. Look at the numbers. We know very well when it comes to the Meru area and the Tharaka Nithi area. They've been voting for Honorable Raila Amolo Odinga in the past. We know very, very well that has happened. You know, sometimes when you're too loud, like few politicians that think that they're too loud, you kind of overshadow quiet people and people that have sort of, you know, on the Meru area who have been voting against, you know, the other part of central Kenya. And they've been voting Honorable Raila Amolo Odinga. When he says that Honorable William Ruto has tested the tear gas, that is not facts. Facts is Honorable William Ruto has not tested the tear gas. What I'm saying here is I think what we are looking at is in terms of what is trying to prosecute here, why Raila has not been on the ground, is perhaps him stepping back and saying, if I played my role as an opposition leader, even the handshake, then it's not going to be possible. I don't think he's waiting for President Uhuru Kenyatta to endorse him. We've known Raila Amolo Odinga of 2007, 2017, 2013, and it's not Raila Amolo Odinga who shies on the crowd. But when you look at the complications that they're in now with COVID-19, it is also possible to say, if he starts these rallies the way he used to do them, everybody's going to cry. We saw what happened in June 1st when people went to Kisumu and suddenly, whoa, coronavirus everywhere. Kisumu was closed for the first time among other places. And so I think is exercising jurisprudence. So it's because of COVID. Is exercising jurisprudence, but besides that, I think he's also noticing that I already have a crowd. These people that we are talking about sometimes will need introduction. Not introduction as to, you know, that people don't know them, but there are places they'll go to and everybody will pass them like, who are you here? You know, what I am saying is this. perhaps the time for campaign has not reached for you to compare the crowds that William Ruto has been having with the Honorable Raila Amolo Odinga.
But can he afford that luxury, though? We know how politics, plays in this particular country. His biggest political rival has been making inroads in that particular region. If you say, let's wait for the right time, let's wait for COVID and all those other factors you're raising, can he afford that luxury?
Maybe not. But I can tell you for free, crowds in Kenya sometimes can be manipulated crowds. And we've seen that. Crowds in Kenya sometimes is not about that candidate, but might be about the opportunity that has presented itself, maybe with influencing a position, a disagreement with their leader for one reason or the other. Crowds itself does not give you vote. If crowds were to give people votes in this country, Serfine, Honorable Raila Amolo Odinga would be long president of the Republic of Kenya. But crowds have not given them votes. So when you see crowds do not qualify that and say, indeed, now he's gotten this thing because of crowds. No, some of those crowds will come out of that place and say, we are still waiting for our kingpin to tell us the direction we're going to go. Central Province has been known to vote in certain ways. By the way, the reason why they've been voting in certain ways is because they've always had a presidential aspirant. It is only this time where we seem to have no clear presidential aspirant in Central Province. That's why people are taking sides. But I can tell you, they will still have their king. They will still have their kingmaker in that region who will say, this is the direction I want you to go to. And I don't think that direction is towards William Somaya Ruto.
I don't know, but that's what you say. But you're right in saying that the central region has always voted in a particular way, and we have never had this agenda of unity when it comes to the central region. They've always walked towards a particular direction. Suddenly it's not clear where they are headed, and we've had even leaders coming from that particular region also talking about bringing the region together. Let's speak in one voice. Could the tide be changing? Could something be happening in Mount Kenya with regards to their unity? And of course, also tell me, Edgar, what will be a make and break for the Mount Kenya region come 2022 in terms of who they are going to support?
Serfine, I want to be on record. I want to advise the ODM fraternity. This is unsolicited. As you have heard my good friend Michael explain how the mountain behaves, it is time to tell Raila Odinga, it is time to tell him that he's naked. The king is naked. And the advice that he's getting from people is wrong, if this is the kind of advice that he's getting. I do not blame them anyway. There is a certain direction in which people think, but the direction that they are going and the direction that the way they want to take the mountain is wrong, according to me, according to how I see it. The mountain has been voting in a certain direction. If you go to the ground, you will hear people protesting certain things that have happened. They protest because they have been sold Raila Odinga as an enemy for a very long time. It is time to confront it and to see where the problem is. We should not wait for the king, the direction of the king from the mountain to tell them where to go.
Is it not important though? Well, look at our Kenyan context and our politics and how we've played it.
Yes.
Is it not important what the king in that region is going to say? Does it add any value?
If it was important, then the Sagana 1, 2, 3, 4 would have mattered. If it was important. It is important to listen to the people and to answer their questions. And it is important to try and understand what they are thinking. Uhuru Kenyatta has been so tough and has given direction. There are people who have towed the line and they have been given a name called Kieleweke. And there are people who have jumped ship and they have been given a name, Tanga Tanga. There is a rift in the mountain and they have to understand that. For me, I look at politics the way they are. I don't want to say you call me Kosgei and I support William Ruto. When he's naked, we tell him that he's naked. When Kiambaa vote is 50%, we tell him it's 50. And this is 1, 2, 3 that you have to do. And my work here, I just came to sit here just to look at how it is. And I'm giving them unsolicited advice.
For free. Anyway, Edgar, you've just talked about the division in the Mount Kenya region. And the second part of my question actually was, you know, how this is going to be a make or break moment for the Mount Kenya region come 2022, because the person we are looking at as somebody who is being succeeded in this general election comes from that particular region, and you have categorically stated that among the presidential candidates this time around, it's not clear whether that region is going to present a presidential candidate. There has to be something at stake for them. What is it that they have to do to ensure that even if somebody from that region is not a president at the end of the day, they still maintain, you know, what they've been having all this while, they've been enjoying all this while? What is it that they have to do? How should they go about this whole equation?
I think that is a very fundamental question, make or break for the Mount Kenya region.
Yes.
And I say this with great authority. It will be very foolhardy to not imagine that Mount Kenya region want a stake in the next government. Hence the reason why some are still holding with President Uhuru Kenyatta, while some are holding with William Samoei Ruto, because they're not sure. And because they are uncertain about it, they want to make sure that each camp wins. The camp of the Newscheck through Honorable Raila Odinga, and some will hold there, and the camp for William Samoei Ruto, where some people still believe that he will be the next president, regardless of what you say. The only thing that, however, will separate this issue, the real grain from the chaff, is the electorates. And I say that when I know for a fact that there will be split in central Kenya, there are people that if Honorable Raila Odinga, I know for sure is going to run, will vote for Honorable Raila Odinga, and there are people that will vote for William Samoei Ruto in Rift Valley. It will not be awesomely for one individual. And as a result, the only make and break is who chooses somebody who is a deputy president from central province, or who decides that the position of the Speaker of the National Assembly or the Speaker of the Senate comes from Central Kenya. Which position, what these two protagonist group are doing is they're fronting themselves and they're saying that we want a position, and this position must be clear from the word go for us to support you. To me, I think that's a very mature democracy. A democracy about the people, and democracy about placement and positions for the area for them to give you the votes. We know for a fact that that is a discussion that we are having. We've had many people from Central Province saying we want Deputy Ruto, we want Deputy President William Samoei Ruto to get a Deputy President from Central. But we are also having some people now saying, Honorable Raila Odinga, we need you to get a Deputy President from Central. That will be the break or make it in this political chip that we are having today. But I want to say this again. I don't think Honorable Raila Odinga is sleeping. I don't know whether Edgar is aware, and he's aware because he's a political analyst, so he knows what is happening. There was a team that came from, Luo Nyanza and went to Central Province and met with the elders in Central Province. It was being headed by none other than Dr. Oburu. And then there's a team also came from Central Province and went to Bondo, and met with the elders there. I think there's a lot of talking going on because some of these things, as Edgar has rightfully put it, they're historical. Some of them are also very, very discriminative in nature, but it's been passed through generation and generation. And for you to take it out of the mind of these people from what their grandfather told them, perhaps a little talk will do. Remember that previously it was very difficult to find a Kikuyu being married to a Luo, and it was also very difficult vice versa. Today we know that if you're a Luo, for example, you must know somebody within your community that has gotten married to Central Province. And that means that the things that were even told that could not happen are happening today. There's nothing that is impossible. Okay. But I want to, as I finish this, I want to say something. Honorable Raila Amolo Odinga went and worked with President Moi, who had jailed him for over 9 years. He came and worked with, and later on, he even became the Secretary General of KANU. And he's worked with William Somaya Ruto. William Somaya Ruto was such a powerful person in the Pentagon. And then, of course, they separated. And eventually, William Somaya Ruto joined President Uhuru Kenyatta. And they won and became the president and deputy president. What I'm saying is what you began with here today. It is practically impossible not to think that none of these people can work together until such a time when the votes are counted. Anything is possible.
A day in politics is a very long time. Edgar, I want you to react quickly to what he has just said. What do you foresee yourself from where you sit?
It is quite unfortunate that what we're discussing here are tribal politics. Someone should come from Central as a vice president. Someone should come from that place as a vice president. I am happy that we are starting a conversation about the economy of the country. About other people are talking about bottom up. Another person is talking about made in Kenya, by Kenya. Musalia Mudavadi is talking about economy. 2022 will try to go away from we want our own, from the mountain to be the vice president. We want our own. When will the 42nd tribe test the presidency in this country? We need to move on, even from a national television like this. We need to move on from tribal talks, and the mountain has to be in, the mountain has to be out. I proposed to Raila Odinga that he should not even look at the mountain, or talking about tribal. He should look at how Kenya is going to move forward. Let him be validated first as a person before he chooses someone. As we are also trying to validate William Ruto in the name of economy, not in the name of the mountain. I like predicting. He might not pick someone from Central. And he might not pick even a man. Let's talk about women. Let's talk about gender balance. Let's talk about the economy. Let's talk about how Kenya is moving forward. And I'm happy he has talked about Luo and Kikuyus coming together. That's good. Let's forget about it. Let's move forward as a nation.
All right. A lot of free advice. We've really run out of time for this conversation.
I want to remind Edgar
very
that
quickly.
Politics is about numbers.
Yeah.
And when we talk about the Rift Valley and we talk about Central and we talk about Western, it might not look like we're talking about anything else that is very important. But those numbers matter to presidential aspirants.
Yeah. Thank you so much, Michael Agwanda and Edgar Willikos-Gay, for creating time. Of course, in politics, we can never conclude. Thank you so much. You have really advised the ODM leader, Raila Odinga. Is anyone listening? That's something they should. All right. Thank you so much, gentlemen, once again for creating time. We have been, the show you've been watching is Newscheck. Today we have been talking about COVID-19, and of course we've winded it up, just focusing on the political happenings in the country. Thank you so much for watching until this far. We are going to be paving way for the Swahili version of the program, Tamrini and Kurunzi Mashinani, coming up later on. My name is Serfine Achieng. Ouma, our sign language interpreter has been Anne Wangeshi. Have a lovely day.
ipepete, ipepete. Ipepete, ipepete.
Yo, mambo vipi watu wangu popote pale mlipo, nasema asanteni sana jamaa kwa kujiunga na mimi kila wakati kupitia kipindi Top Mashariki kupitia Channel 1 au sio? Nambari 1 mtu wangu nchini Kenya, KBC.